Hi, my name is Sarah Grace, and this is my video interview for Johns Hopkins Children's Center. The aspects of child life that appeal to me most is being a steady, supportive presence in the midst of uncomfortable medical experiences. I've been on both sides of the spectrum, both through my child life practicum, kind of on the child life side, and being a patient myself. Being on the patient side of things, it helps me have a lot more understanding for how dysregulating that experience can be. And child life really brought a lot of help and cure and understanding to me and my family during that. My goal is to work in a clinical setting, hopefully in a hospital, and provide family-centered care that is really strongly related to my hospital's values. An example of when I saw the value of play would be in my pre-internship nanny experience. I nanny for a girl on the autism spectrum disorder, and we were able to create a game with stuffies where we were able to label emotions and model emotional regulation and kind of model like play with those stuffed animals. And it was really rejuvenating to see her labeling emotions and starting dialogue with all those things and mocking emotional regulation and calm body and things like that. My practicum experience gave me a lot of feedback and we were able to meet every week and kind of take that feedback and roll with it. So in the first week, it was kind of uncomfortable for me with that huge language barrier. I was in an international setting, and so because I had never done that before, it was just a little bit uncomfortable. And so my practicum preceptor really challenged me to create rapport relationships and important play through nonverbal cues and communication. And by the end of the 5 weeks, I was able to do that confidently and walk into a hospital room where we had a big language barrier and do things confidently and provide play with limited resources and limited verbal communication. Two experiences that prepared me the most for my clinical internship. My first one would be my nannying job. I learned how to tailor play to specific individuals with different developmental needs. Her and her sister are both on different tracks, and I was able to kind of facilitate group play, but tailor it to each individual and learn how to emotionally regulate them within that realm of things and make sure that each person is seen, but they all are getting something out of the play that we're providing. I was also able to learn how to provide emotional regulation, both to Rochelle with autism and Danny who doesn't have autism. I was able to provide emotional regulation for two very different types of kids and kind of learn how to do that within a clinical setting, a home setting, and kind of just public setting, just out and about. My practicum experience really prepared me for my internship experience because I was able to learn prioritization, clinical flexibility, some leadership skills within your practicum group. I was able to learn how to facilitate group play and individualized play with limited resources and limited verbal communication, as I spoke on before. Was able to work hand in hand with my child life preceptor and really learn what advocating for child life was like and how that really was a big part of the job, especially in the international setting. For the emergency department scenario question, If I walked into there, I would be thinking, okay, 15-year-old male, teen is likely scared and in pain and feeling alone, especially because it wasn't stated that his parents were present. According to development, I would prioritize trust, privacy, and autonomy, and I would use some type of nonverbal communication to ensure that he is feeling that way and understanding what is going on. Some options would be like writing or drawing or typing if he had like a cell phone with him. I would try my best to create a calm and supportive environment where he felt like he had a privacy and autonomy and he understood what was happening to him. And I would work with my supervisor to ensure that I was providing care in the realm that I should be. I would also work to make sure to find his parents and see where they are at so they can provide that parental support that I can't necessarily provide. Thank you so much for this opportunity. Hope to see you guys soon.